canal.
Come in.
Hi, my name is Kevin. I'm a PA student, and I'll be helping you today. And you go by?
Will.
Will? All right, Will. So, what's bothering you today?
I've got slight discomfort right here in like my private parts.
Okay. How long have you been having these symptoms? Any pain at all?
No pain really. It just feels weird, and it's probably been going on for like 10, 14 days maybe.
Okay. And do you know what could have caused this condition?
No, I can't think of anything.
All right. Do you smoke tobacco or drink any alcoholic beverages?
No, I've never done any of that.
Okay, very good. So what I'm gonna do now, I'm gonna take a look at the area, okay, and get a better look, and then help me diagnose this condition. Is that okay?
Sounds good.
Okay. So what you have here is a condition called indirect inguinal hernia. So a hernia is when part of your abdominal contents, say your intestine, protrudes out of your abdominal wall. What makes it indirect is that it happens a little bit lateral to the side of your body. You have a little artery right here called the inferior epigastric artery, and the hernia just occur a little bit to the side of it, okay? Now, the second thing is that it follows your spermatocord down to your scrotum, and it will go through the inguinal canal, which pass through the deep inguinal ring to the superficial inguinal ring, then into your scrotum. This condition, is fairly common among men, and there's a lot of factors out there that can cause this condition, whether it's age, sex, ethnicity, you smoking tobacco, or it could be due to an injury because of physical activity.
I understand. So what exactly is an inguinal canal?
All right, very good. So the inguinal canal, so if you look right here, the inguinal canal is a little passageway. So it starts right here from the anterior superior iliac spines, and it kind of go a little bit down, inferior to the middle, medial to the pubic tubercle right here, okay? And there's a lot of muscle and ligaments around this inguinal canal, and major arteries and nerves pass through this canal. So your hernia, part of your abdominal content, just kind of slip through and follows this canal down into your scrotum.
Okay.
Okay.
So this feels really strange. What should I do about it?
So I would recommend a laparoscopic surgery. I can make a referral to the general surgeon for you. The general surgeon will go in and make a small incision on your abdomen, retract the intestine back into the abdominal cavity, and place a mesh over the little area that the intestine slipped through for future incidents.
Sir, do you really think surgery is necessary?
I would definitely recommend it. As I mentioned earlier, you have some major arteries and nerves passing through the inguinal canal. We don't want to block any circulation down there, and we certainly don't want to strangulate your intestine either. So getting the surgery is going to be really good.
Okay, let's do it.
So what we have right here is a closer look at the indirect inguinal hernia. We have the small intestine right here, or part of the abdominal contents. It's going to slip through this opening a little bit lateral to the inferior epigastric vessel. It's going to follow through the deep inguinal ring pathway down into the spermatocord. Compared to a direct inguinal hernia, that's going to occur a little bit more medial to the inferior epigastric vessel, and it's going to be, when it goes down the deep inguinal ring into the inguinal canal, it's going to protrude out and somewhat parallel to the spermatocord instead of being inside it.